So basically what we're doing is we're drawing blood into this tube, and then we're going to put this tube into a centrifuge which spins it really fast, and it's going to separate the red blood cells from the platelet-rich plasma or growth factor, or both are in there. And basically that's what we call kind of liquid gold there.
Okay.
And then we apply the growth factors to the face and then penetrate them in with the needling. When you needle, just needling on its own stimulates your own platelet-rich plasma within inside to stimulate collagen. But when we apply it to the skin during this treatment, you're getting double the benefit. Fold your arm for me. The blood has spun for 5 minutes, so now what we're going to do is take it out. And you can see all the red blood cells below, and then wax separating all the growth factor platelet-rich plasma.
That's awesome.
Okay. All right, so we use disposable needle tips that are one-time use. And basically, this tip has 12 needles that punch through the skin. I don't know if you can see that. So it just loads right onto the pen. And then we can turn it on to whichever depth and whichever, however fast we want. And then it just penetrates those needles forward.
Okay, and where does...
And then this is what we'll apply to the face during the treatment.
Yeah, it does. So you put on the numbing cream about 45 minutes to an hour before, and I have to say this numbing cream is amazing because I cannot feel my lips. It's actually like going to the dentist, how you almost can't drink, which is great because...
All right, so we've just finished cleaning the face, and this is the growth factor or the platelet-rich plasma that we're applying to the skin. And we're going to needle it in.
Now this area is probably more sensitive, I would imagine, right?
It's a thinner tissue, so people tend to feel a little more on the forehead than the rest of the face.
And I can't really feel that. I mean, it feels like a little tickly.
So on a scale of 1 to 10, 10 being excruciating and 1 being almost nothing, what would you give it?
Oh, 1. Yeah, I mean, honestly, it's just a buzz, a vibration. Yeah, see, that's surreal because there's not a lot of tissue up there. So you would think that you would feel every...
Maybe like a microderm or a cat scratch kind of feeling.
Exactly, yeah, because I have had a microderm before, and it kind of feels a little bit like that, yeah. Every now and again, you can kind of feel like a little...
One here or there.
Yeah, but it doesn't hurt.
So I tell my clients that your treatment is really based on the quality of the treatment given. So not everybody makes the right number of passes and gets a good aggressive treatment. And then the depth of the needles is really dependent on the area that we're working on the skin.
Oh, okay. So maybe the depth wouldn't be as much up on the forehead area?
Exactly.
Oh, I see. Okay. Oh, that makes sense.
So as you can see, the growth factor we applied is gold color. This red is because we're actually getting down to the blood supply with these needles, which is where the skin is forming. And basically, when you stimulate those brand new cells, they come up firmer and tighter. So this is referred to as bridge therapy. So if you can imagine a fissure or think about a wrinkle, how it creases down, this wounding is causing that crease to bridge together with new, healthier cells.
Okay, kind of like you have to burn down the forest in order for new growth.
Exactly. So this is kind of wounding the tissue.
See, like that right there is, I don't even feel the occasional little That is so amazing. And the needles are going deeper here, correct?
Yes, these are going about twice as deep as we were doing on the forehead.
That is amazing. I don't know if we got this on camera, but a pharmaceutical compounded numbing cream makes a huge difference, and that's what you use.
Exactly.
Yeah.
You can't buy this over the counter.
Right. That actually feels like a massage.
Yeah.
It feels good.
So needling is excellent for fine lines, wrinkles, pores, skin discolorations, overall just firming and tightness of the skin. This is one of the best anti-aging tools on the market. And the crazy part is that it's super aggressive, but there's virtually no downtime because we're getting deep to the blood supply where we need to, but we're not tearing down the top layer of the skin. When you do a peel, you're taking off that top layer, so there can be a lot of risk for scarring and discolorations and things of that sort. When you do peels are great, don't get me wrong, but peels do not get down to the blood supply like these needles are. And the blood supply is where the tissue forms, which is what is going to make the most impact. The tissue that we're penetrating is about 6 to 8 weeks deep. So what that means is you're going to see firming and tightening today, but in 6 to 8 weeks, you're going to see more firming and tightening. And as a matter of fact, I just did a needling to myself with PRP 2 months ago, and this whole week, all I've been getting has been compliments on my skin. People are like, what did you do? And I'm like,
wow.
nothing. I haven't done anything. And then I think back and I'm like, oh my gosh, I did a needling treatment.
And that's amazing. So, and this is also good for people, or is, I guess I should ask the question, is it good for scarring, like acne scarring and things like that, or is there another?
Acne scarring, stretch marks. I've done breasts, I've done bellies, I've done thighs. Crepey lax skin. It's amazing for neck tissue. One treatment is awesome, but if you're really trying to combat acne scarring, stretch marks, or lax skin, you might want to do a series. You can do these as often as 4 weeks apart. And I had one girl, I mean, sounds like a lot, but she had some pretty decent acne scarring on her cheeks. And we did one a month for 7 treatments. And her acne scars were completely smooth, gone.
Wow. And that's permanent?
It is permanent, and each time you do it, well, so as you age, I mean, it's hard to talk about permanency with the skin because as you age, you continue to break down collagen.
Oh, sure, yeah.
But if you're if you're building more collagen than you're naturally breaking down, you're going to be ahead of the game, and that's what this is doing.
Okay.
So just like going to the gym, once you get your physique, you're still going to want to maintain. So these might need to be done in a little series to get your skin where you want it to be, and then after you maintain. This is one of the best things you can do for crepiness around the eye. You can put Botox around the sides for crow's feet. You can put filler into the indentations to give structure, but that skin, that crepey little skin, there is not a whole lot you can do. Creams can do so much, they'll help out, but this is actually stimulating collagen into the actual skin itself. So it's actually increasing the quality of it. So basically how this works, it's kind of, like growth factors. And basically what growth factors do is when you put healthy cells in, it talks to the other cells and tells them to replicate. And so it'll actually cause the damaged cells to fall away. And then just like I said, the wounding of the needling itself stimulates its own growth factor and collagen. And it sounds pretty kind of gruesome when you say wounding, and especially if you see somebody's face turning red like this. But
yeah,
I mean, when you have the numbing cream, it's awesome. When the numbing cream wears off, you just feel like you got a warm little sunburn. There's no major pain,
and you're not red like this after either, right?
Well, the blood we're gonna wipe off today before you go home. Let me get some more growth factor. The redness that you have today, by tomorrow will reduce by half. Okay. Tomorrow you can put makeup right over the top to cover it up.
Okay.
So again, there's virtually no downtime.
That's incredible because, this just seems aggressive, then you would think
It is aggressive.
that you would have a good week at least.
Yeah, but it's that top layer protective barrier that makes you heal so quickly. All the healing gets done internally.
Okay. Oh, wow.
You can only go so deep with peels, so deep with laser without damaging the skin because it's so thin and very sensitive. You can't do to the neck really what you can do to the faces in terms of like, deeper peels. So necks generally require lighter treatments, but more of them. The needling, it's about the same depth as the forehead because it's a thinner tissue. But like I said, the neck just is not as resilient as the face. There's not as much blood supply to the neck as there is the face. So there's less vascularity. But this needling does amazing for the creping and the fine little lines. The outcome is awesome. I can honestly tell you, aside of Botox and filler, this is my third most favorite anti-aging tool.
Okay, so what's your first, your number
Well,
one?
Botox and filler, they're two separate things. They do two different things. Botox relaxes the dynamic movement that causes the frown in the middle of between the eyes and also the crow's feet. It also helps out with the forehead lines. Filler fills in those deeper gaps where we've lost a lot of collagen from smiling or from pursing or just cheek loss. So filler will actually lift your face. You can do a facelift without surgery if you use the right filler and place it in the right places. So this is what would be considered vampire face lift, and that again is not my term, but basically this is injecting the PRP into creases like you would do filler. This is liquid, so it's not as thick and viscous as filler. You're not going to get that upfront structure like you would filler, but over time this is going to build more collagen into the areas that we're injecting. So I'm going to start on your little scar on your top lip here. I'm going to try to get past your arm if I can.
You know what? Let me do this.
Do it that way.
Yeah.
And you'll want to take some close-ups of that scar as it settles down.
Oh, okay.
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 You can inject this under the eye. Let's put a little teeny bit there here.
That is actually going in the skin. I can't even feel that.
Yeah, but look at already the volume on the eye. Now that's going to reduce some because you're going to absorb some of that away.
Okay.
But that's going to re-establish volume under the eye. See how that one's viewed and that one's not as needed? That's essentially what filler does under the eye too, but the filler actually sticks around a little more up front. But this is your natural collagen here. See those eyes kind of settle down and look more full?
Okay, that
Crazy,
is amazing.
Right. That's that's what filler does also.
Okay.
And you cannot put filler here on these verticals because the skin is so thin, but you can put growth factor and it does amazing for getting rid of these lines. How's the pain doing?
I don't even, I mean, I know you're there, but I don't, I'm freaked out by needles, just FYI for anybody watching this. So.
Oh, you're doing good. I know this looks a little scary, and all those little bumps will subside. They'll all absorb away by the body. Okay, I'm going to come to the other side here. See those lines vanishing there?
That is, okay. Wow.
Okay, now what I'd like to do is just kind of come around through these spots and then we'll be finished. Then I'm going to put a cool mask on you to soothe everything down. Does it feel a little teeny throbby, the places I've injected? Not yet? Okay. Okay, you're done.
Okay.
I'm going to relax you back again here.
Okay.